So in my long career, I've taken care of thousands of patients with hair loss. And one guy I think of, a young man came into my office with his mother for consultation, and he was wearing a baseball cap. And that's the number one myth about hair loss. Wearing a baseball cap causes hair loss. And the mother pulled me aside and said, Dr. Leonard, tell my son that that hat is causing his hair loss. Well, I'm not one to contradict mothers, of course, but it's not true. But that hat is a very important sign for me because this guy doesn't want to go in public without wearing a hat because he's concerned, anxious about his hair loss. So we talk about all this stuff in the consultation. This is not just, come in and we'll give you something to treat your hair loss. I'm a physician and that's my patient. And so it's very important for me, as someone who's been treating patients for all these years, to make sure I understand what their problem is. I can offer them treatments, but I want to know what the story is because that guy, I recommended therapy, but I also recommended he see his family doc or psychiatrist to treat his anxiety about his hair loss as well. So it's much more complicated in some cases than just, oh, my hair's bothering me.
Yeah. Any female story?
I have a lot of stories about women losing their hair, and they're mostly sad stories because they have gone to their family doctor or maybe their dermatologist and they've been blown off because hair loss is not as common. It's normal for a guy to lose his hair, but it's truly devastating for a woman to lose her hair. And so they go to doctors and they say, well, you're in good health, you've got all these other great physical accolades, but they blow the hair loss off because, it's not that much of a problem. Female patients are the most difficult but most wonderful to treat because I can make a difference in their lives. Mm-hmm. These women tell me that they don't sit in a restaurant under the light because the light reflects back in other people's eyes. They don't go to the beach anymore for the same reason. A lot of sad stories, and I'm the first doctor who's treated them as they should have been treated by the first doctor they saw, with respect, with compassion, and with medical knowledge to help them. And if they're not going to have a hair transplant, if they're not going to have other treatments, we'll offer them something, even if it's not medical, to make them feel better living their lives in their own skin.